I want to thank you guys all for coming today. My name is Josh Wynn, out of the Office of the Chief Wellness Officer, Bern Melnick. We have a great Lunch and Learn presentation for you guys today. Before we get started, just a couple upcoming announcements and some housekeeping. Next week is the Partnership for Healthy America Healthy Campus Week. So we encourage you guys to try a new healthy activity. Buckeye Wellness has over 15 group fitness classes here at Ackerman and over at UHE for you guys for free access. Next Friday is Take a Lap on the Buckeye Path to Wellness, starting at 11 from 11 to 1. So visit your nearest Buckeye Path to Wellness station to get started. Last, as far as for today, we're going to have about 10 to 15 minutes for questions and answers at the end, so hold all questions till then. And then everyone should have received an evaluation. Please have that filled out when you leave. We do take those seriously, and we use those for future presentations. Today's Lunch and Learn is titled Athletes and Aging, Keeping It Real and Keeping You Active. We have Dr. Clinton Hartz. He is an assistant professor and physician who specializes in primary care and sports medicine at The Ohio State University Outpatient Care in Lewis Center. We have Kyle Steinbauer. He is a physical therapist who oversees the OSU Wexner Medical Center sports medicine location in Lewis Center. And last, we have Vince O'Brien, who is an athletic trainer for the OSU Wexner Medical Center for sports medicine. So please give him a round of applause.
Thank you. How would we roll this thing? See if I can get this working. All right, so I'm Dr. Hartz, Clint Hartz. So today we're going to talk a little bit about athletes and aging, and kind of get you going from there. Get everybody active since we're all eating salads. So it sounds delicious. So our objectives today, ideally we're going to talk a little bit about the normal physiology of aging. So everybody wonders, well, why can't I do some of the things that I used to do when I was younger? Well, we'll discuss that a little bit. It's not just you, it's natural. Also discuss some of the exercise indications, joint health, common injuries, and go over kind of typical exercise prescription, kind of common injuries that you may see with certain activities, and discuss injury preventions, and then a little bit of list and recovery methods of how to get over that. So hopefully none of this is repeat to anybody, but just kind of the natural physiology of aging. There's a lot that goes into it. So yes, we lose a lot of muscle mass and things over time, but a lot of it comes down to your cardiac output too. So over time, as your body ages, you lose the cardiac output. Blood pressure naturally goes up because of increased peripheral resistance. And then your VO2 max, oxygenation, tends to decrease with time as well. And then you'll also tend to lose some of that lung vital capacity. In regards to the muscles, you tend to lose a little bit of that reaction time. So it's not uncommon that you can't do some of the things you felt like you could do because you're losing that reaction time. Your strength tends to go down. You lose a little bit of that muscle endurance. Good news, this is all natural. It's nothing you're doing wrong. The cartilage structure tends to get a little bit weaker, a little more friable, and puts you at higher risk of kind of developing some arthritic change and arthritis. And then your bone mass, especially in women, can tend to decrease. So that's why we kind of preach, and we'll talk a little bit about exercise and weight-bearing exercise, especially to kind of help maintain bone mass, because that tends to peak in early 30s. And then increase in loss of flexibility, and then you increase in free fat body mass. So it's not just what you're doing. Everybody naturally gets that. Not only that, you lose a little bit of your glucose tolerance, so you become a little bit more increase for loss of insulin sensitivity, and then your metabolic rate, which is your body's ability to kind of just burn fat while we're just sitting here, that tends to decrease. So a lot of fun things that happen with aging. So some of those too, unfortunately, people, if you have some of these underlying medical problems like diabetes, coronary artery disease, or hypertension, and osteoarthritis, all that can also exacerbate some of those things that we just talked about. So not only do you have the aging process, but you also will have these medical conditions that can make this a little bit more difficult. However, the good news is, right here on the bottom, exercise may help modify some of these risk factors. So keeping you active is very important, and we'll discuss that here today. So if you are a weightlifter or a weight trainer and you like to say, well, I just don't feel as strong as I used to, Unfortunately, after the age of 35, you lose about 1.25% of muscle mass per year. That's natural. That's nothing you're doing. And then your peak muscle strength tends to decrease as well. So especially after the age of 70, good news, doesn't look like we have anybody that age, but it will decline rapidly after the age of 70 as well. So trying to keep some of these activities and strengthening and all that stuff now is important so that you can maintain a healthy, active lifestyle when you're an older adult. So the rate of decline tends to be equal among men and women, but you can delay this. Good news, everything can be delayed, as if we do some consistent resistant training and all that, what we'll talk about. So physical activity in the aging process, it does increase your average life expectancy. So that's very important. I know we preach that. It's kind of with this whole thing, exercise and aging. It can also favorably influence the physiological system, so hopefully mitigate some of those factors that we talked about in the beginning. And it can also kind of determine whether or not what you do now and kind of throughout a little bit older in your 40s and 50s, it can determine exactly how you could potentially age and what you do as an elderly person or an older person above the age of 65. Are you able to still go out and walk? Or are you going to have the disabilities from a stroke? So the things that we do now definitely are important in how we respond later in life, and hopefully in our golden years are able to stay active and stay healthy. So this is just some evidence, kind of the benefits of physical activity and exercise. Obviously, everybody knows that exercise is good for you, and we want you to exercise, but this is just some of the evidence out there that vigorous long-term participation in what we call AETs, aerobic exercise training. It helps increase your cardiovascular reserve, so it makes you able to exercise longer. You'll get some skeletal muscle adaptation, so your muscle strength will stay longer. You'll be able to do more aerobic activity for a longer period of time. You'll also get improvement in overall psychological well-being. So a lot of times depression, anxiety, a lot of people that deal with that. So by just exercising alone, you'll increase those endorphins. It'll help you kind of the serotonin in your body, the happiness. It increases all that and improves self-awareness, self-esteem, self-concept. Not only that, you'll be able to keep your memory for longer. So it keeps you smarter, keeps you active with the blood flow, and it will help decline the risk of any family history of dementia, Alzheimer's, those types of things, cognitive decline. Not only that, and just aerobic exercise, which I know a lot of people will probably say, well, do you exercise? Yes, I try to. It's not just physical activity. We want to talk about resistance, so weight training, lifting, things like that. So it's not just getting on a treadmill and going 20 minutes, 30 minutes on a treadmill and coming off. There's other things that we'll talk about that can be helpful. So that also increases substantially, especially in older adults. So it can help you impact getting up from a chair, walking for longer periods, your balance, especially risk of falling later on and having more problems. There's few controlled studies out there that talk about flexibility, but trying to stay flexible, keep active, that helps kind of maintain joint mobility and decrease pain long term as well. So just kind of talking about some medical conditions. Well, what are the benefits of exercise, medical conditions as well? So a lot of people may in this room, some of us alone, helps improve your hypertension, improves non-fatal myocardial infarctions, decreases your risk of coronary artery disease. But the main thing, those regular exercises, a benefit for these. But one thing is if you do have any history of this, or even without a history, or you're going from nothing to a lot, you want to make sure that there is a small percentage of people that can get an increased risk with vigorous exercise, and we'll kind of talk about the exercise scale a little bit later, but with vigorous exercise of actually having a heart attack. So if you haven't exercised in a while and you may, of a certain age, then you may, and have some underlying medical problems, it may be prudent to talk to your primary care doctor or a cardiologist about when is it safe and what type of activity would be safe. However, the benefits, the risk-benefit ratio, that's what we always do in medicine, is take the risks and the benefits. Well, what's the risk of having a heart attack versus the risk? But the benefit outweighs the risk with a regular exercise. So not only that, different cardiac conditions can kind of respond differently. So even if you have high blood pressure versus a prior heart attack, sometimes we'll treat that a little bit differently. So it's got to be individualized. And think of your heart as a muscle as well. So it is muscle. So if you can exercise with resistance training, it may be some benefit of actually improving cardiac function. So just kind of talk a little bit about hypertension. So if anybody here has high blood pressure, hopefully not, but if so, these are kind of the guidelines of the kind of stages of hypertension. It does unfortunately increase with age, but if you have a basically this says is the target organ, without any end target organ damage, if you're in under 140 to 150 or below, you don't necessarily need any pre-clearance for activities. However, if you get above that into the 160 to 100, you definitely want to make sure that you get that under control before looking at doing any type of activity, especially resistance training or weightlifting, as that can increase blood pressure significantly. So just getting an evaluation or routine physical to make sure that that's improving. So diabetes as well. So even exercise in children, diabetes as an adult. So you don't necessarily have to have pre-medical clearance if you have underlying diabetes to get back into exercise, especially if you're asymptomatic and low. But you want to make sure that if you're going to look to increase more than just a brisk walk or a light jog, that you kind of get that looked at prior to activity. Just in general, for the regular lay adult that's getting back into activity, you want to make sure we strive for that 150-minute a week mark. So if you can think of anything, just think of that 150-minute per week. Ideally, we want to spread that over 3 days, and kind of no more than 2 consecutive days. So every other day of activity, trying to hit that 50 minutes per week. If you're a higher level athlete and you want, again, to get back to activity, especially vigorous activity, and you don't necessarily have to hit that 150 minutes a week, you can get that down to 75 if you're doing a certain amount of METs that we'll talk about, but vigorous exercise like jogging, lifting, things like that for more physically fit individuals. So that 75-minute per week is also appropriate. So now just kind of a little bit of what we see a lot of every day and kind of the bread and butter. Well, my knees hurt, I can't get back to activity, and I'm having trouble kind of exercising because of the pain. So even though that you'll hear us preach, especially in my clinic a lot, is if you have some knee arthritis, hip arthritis, anything to that nature, we show that even though you have pain and discomfort, exercise is beneficial. So trying to get into that routine. Also, we'll likely get you over, and Kyle will kind of go over this a little bit later, getting you over some land-based therapeutic exercises. It's also been shown to kind of reduce pain and improve function. So that's not something that I know a lot of people, especially I get backlash a lot. Oh, do I have to go to physical therapy? Well, there's a lot of benefit in physical therapy and getting you moving, and making sure you're doing it right. Not only that, they lead to improved physical health and overall impact of just the general degenerative disease of arthritis. Some non-operative, so if anybody in here has any arthritic change or knee pain, things like that with exercise, these are some kind of non-operative things that you can look at. So obviously we preach a lot too. Hopefully none of this is the issue, but weight loss. Weight loss is very important, especially when it comes to arthritis. So even losing 3 to 5 pounds of weight will take 10 to 15 pounds or more off of that knee joints. So there's also options. We preach Tylenol initially, but a lot of people don't have the same effect that they get from like an ibuprofen or an anti-inflammatory. However, NSAIDs or anti-inflammatories can have some caution, so you want to make sure some side effects. So make sure you're actually medically stable enough. So if you have severe high blood pressure, kidney problems, GI bleeds, NSAIDs might not be what you need to take without consulting a physician first. A lot of people may look at, glucosamine chondroitin, osteobioflex, these type of medicines. They still remain controversial. A lot of the literature just basically says that you have to take these for on average of 3 years before noticing a difference. But that's a long time, and they can be costly. But there really no big significant difference in regards of taking that or not. And I get a lot of patients that want to come in and, hey, can I get an injection for my knee so I can get back to activity? Yes, absolutely, that's an option. Problem is it's a very short-term relief. And we tend not to do these long-term because that ultimately steroids can be kind of terrible to the joint. So we got to may look at doing something else. And that something else could be something like what we call viscosupplementation or hyaluronic acid injections or hyaluronate injections that kind of help mimic the articular cartilage to kind of think about it like paving the road, putting a little bit more surface, decreasing the cracks in the road. The other thing that we do a lot of, and kind of hope to talk of information of, is kind of orthobiologics. It's a new up-and-coming area. It's been around for a period of time, but it's used to be used for tendinopathy issues and tendon problems, but now we're seeing a lot more of it beneficial with arthritic change and osteoarthritis. So platelet-rich plasma, stem cells, things like that. Stem cells are kind of falling down a little bit because the FDA is really starting to crack down on what they consider a new drug and what they don't, so we're not doing as much of that. But and then just kind of activity modification. So even if you can't walk on a treadmill or kind of or jog or run, doing something is better than doing nothing, whether that be getting up out of your chair and kind of just taking a little bit of a stretch, things like that while you're at work, 10 to 15 minutes. Doing cross-training, whether you bicycle, elliptical, doing something, swimming even, can be beneficial just to help get that joints moving, get those pain down, and then allow you to start to strengthen the muscle. And then obviously, a lot of times we'll get you back into kind of physical therapy to work on the hamstrings and that kinetic chain. So what are the actual guidelines? Well, the American College of Sports Medicine, like I mentioned earlier, recommend 150 minutes a week of physical activity for just generalized health benefits. However, the Department of Health and Human Services, they recommend that you can get additional benefits if you want to go above and beyond that, and especially doing higher intensity and higher frequencies. But for just that, for the kind of 40, 50, just hitting that 150 mark, that's 150 minutes is what we look for. Obviously, if you can go above that or do a little bit more, that's ideal, depending on what your condition and your abilities allow. So we kind of look at moderate intensity exercise, try to get 30 minutes or up to 60 for greater minute, even if you can't do so. If some people have a hard time in your day just dedicating an hour to exercise, well, okay, well, maybe break it up into 10-minute intervals. So just that you're doing something to kind of get that 150 to 300 minutes a week. But like I said before, if you're able to do more vigorous exercise, pretty big jogging, strength training, a little bit more moderate intensity, trying to hit that 75 to 150 mark is good. So okay, you've been preaching this intensity. Well, how do you gauge intensity? Well, kind of do this talk test. So basically that is a simple way to kind of say, well, what's my activity level? Am I in a marathon or what am I running? Basically, it kind of helps you measure your intensity. So moderate intensity activity is you can talk, but you can't sing. I can't sing anyway, so that doesn't matter. But if you're doing any vigorous intensity exercise, you'll be able to say a few words. You can't talk more than a few words without taking a breath. So that's kind of a quick gauge to kind of figure out, well, what's your activity level at that point, and kind of whether if you're doing moderate or vigorous. So then kind of for the duration, like I said, the 10 minutes and the 30 minutes a day, 10-minute intervals if possible. And like I said, what type of activity can you do? And we'll go over a little bit more, but anything that doesn't impose the orthopedic stress for arthritis, things like that. So the cycling, the ellipticals, swimming, stationary bikes are very good just to kind of get those range of motion moving. The other thing we talk about, I don't want a lot of people to forget, is resistance training. So, I mean, a lot of people get on the treadmill and run for 20, 30 minutes at a time, but it's beneficial to try to get at least 2 days a week of resistance training. Trying to do the major muscle groups, and Kyle's fortunate to go over some of those a little bit later, but hitting your quads, hitting your glutes, the hamstrings, hitting your upper body, working on good core, those things, those muscle groups, things that can help. Just small things like doing one-step little stair climbers where you just kind of go up a step here, getting up out of chair in the off. Some of these things you can even do at work. And then even flexibility. Like I said, flexibility right now, there's still some kind of evidences poor on whether or not, but trying to keep good flexibility is key. So trying to do that into 2 days as well. So what I tell people is try to stretch both before you do your activities to kind of loosen up a little bit, and then have a cool down stretch. So post-activity. So if you're going to weight train 2 days a week, add your stretching in both before and after. That'll kind of take that up. And then looking at balance. Balance can also be important for somebody that if they have instability or kind of frequent falling or kind of feeling like you're kind of unstable going up and down steps or feel like your knee's giving out. So those things that I won't kind of go over because I'm hitting my time limit here, but and we'll kind of introduce some postural groups and things like that Kyle will kind of go over a little bit as well. So, and then just some kind of quick special considerations. So obviously if you have nobody does not look like anybody in this room fits these categories. But if you have a family member, anybody that's really deconditioned or has not been going, just think about it. Go slow, and they'll slowly kind of increase in increments. A light progression based on tolerance and their preference. So if it's too much initially, don't want to go out and try to have to run a mile or 2 miles if you haven't done anything right away. You can do a run, walk, jog, things like that. So just remember to go slow and increase your strengthening that way. All right, well, I'll let Dr. Kyle Steinbauer come over and kind of go over the rest.
Hello, everyone. Can you guys hear me? Awesome. Well, I just wanted to set a couple ground rules here before I got going. I wanted this section to be useful, but give you guys a broad interpretation of what we do every day, the patients we see. And this isn't meant to be a comprehensive list of injuries or treatments, but to give you a couple things that you could possibly take home today or this weekend and maybe try and self-treat yourself a little bit. I have a couple goals for my section, and number one is just to have a better understanding of common orthopedic injuries that we see in our clinic every day. And like I said before, some concrete things that you can do to help combat some of these injuries. And then most importantly, at the bottom here, learn when to seek help. And that's a really important step with the process that oftentimes gets skipped. So I think it's really important, and a lot of people don't understand. I really want to talk about the difference between mobility and stability. In our joint, we're kind of set up in this alternating fashion. There we go. Where the yellow blocks here are stability joints, and the red circles there are mobility joints. And we need a good balance between these two for proper functioning and proper athletic movements and activities. The focus today is mostly on this mobility section because with an aging athlete, we're typically a little stiff, myself included, and that's typically where we see most of these injuries with the aging athlete. But stability is also a huge focus of ours with our treatments with our patients. And like I said, depending on the activity and depending on what you like to do for exercise, we really need a good balance between these two. Another point I'd like to make is the difference between sport-specific and cross-training exercises. So what research shows is that in order to be really, really good at something, we need to practice it over and over and over. And that's where that sport-specific exercise comes into play. So if you want to be good at tennis, you're not cycling all the time to be better at tennis. You play tennis. You do tennis-specific activities, tennis-specific exercises, and that tends to carry over to improve performance on the court. But, so in order to be good at your sport, you need to do sport-specific exercises. In order to do your sport for a long time and with less pain, we need to do cross-training exercises. And what that means is something other than tennis. So whether that's weight training, whether that's going swimming or cycling or playing basketball, something to give your body a break from that repetitive type motion. And a lot of this research is coming out, with children as well, and they're saying that athletes that only play one sport their entire life have a way higher incidence of injury because they're not getting these different muscle groups activated and things like that. So these are kind of a very broad group of some of the major injuries or conditions that we see in our clinic in the aging athlete. And I'm just going to briefly touch on each of them. And once again, these treatments are not comprehensive by any means. So Achilles tendon dysfunction or tearing. I'm going to go over a little bit later on what sports these typically happen in, but this is a very, very common injury that we see. In the aging athlete, we tend to see more distal Achilles injuries, which closer to the heel. In the younger athlete, we tend to see them up a little bit higher. But common treatments for treating Achilles tendon dysfunctions are beginning with eccentric loading and then concentric loading. The difference between the two, eccentric loading is strengthening while lengthening. So it shows that we're able to put a little bit more force through these tendons, doing it eccentrically, and it causes a little bit less pain. So it gives us an opportunity to strengthen while that tendon may be a little bit flared up or injured still. So eccentric loading is important with the Achilles because it's what we do in our normal everyday gait pattern. and we do it with our running pattern as well. But we need to get to this concentric loading eventually, which is strengthening while shortening that tendon for optimal recovery. Obviously, activity modification is huge. So if you come in with an Achilles injury, it's typically best to take a little bit of a rest and get your tendon right before we kind of proceed. Ionophoresis is a way of administering a non-steroidal medication through the skin that we often do in our clinic, stretching, and then foot orthoses as well. So as Dr. Hartz alluded to earlier, I'm just going to quickly go over knee and hip OA because he kind of talked about it. But I think now I'm not a radiologist or a physician, but I think this picture over here is pretty easy to see. So you have the 40-year-old triathlete and the 70-year-old triathlete. As you can see, there isn't a whole lot of difference between their muscle mass. So this dark stuff right here is muscle mass, the white stuff's the bone. But you can see a sedentary 70-year-old male, you can see the difference between these two. Obviously, a lot more fat around the area, and our joints and muscles and tendons crave loading. They want to be used the right way. And without that stability, our joints just tend to have a lot less freedom in what they can do and a lot less stability there. So as Dr. Hartz alluded to before, weight management's a big thing that we talk with our clients about, but flexibility and strengthening is one of the biggest things that we do. I like to use the term motion is lotion with our joints. It's a little bit of an exaggeration, but it gives people the idea. They come in and they say, I'm hurt and I can't move. Well, and then I'm going to say, that's exactly what we're going to do to get you feeling better. And these are obviously patients that have been cleared by their physician to come in, and they think that they're deemed for physical therapy. But we treat patients all the time that come in with moderate to severe knee or hip or shoulder arthritis. And I'm not saying we're curing them by any means. If so, I'd be making a lot more money. But symptom modification and allowing them to still do the things they want to do. My job as a therapist is to get you back to the activities you want, not tell you things that you shouldn't do. Patellofemoral pain syndrome, this happens kind of across the lifetime of a joint or of an athlete, but oftentimes happens in that 40 or 50-year-old person that's kind of overdoing it a little bit. And it's an irritation between the kneecap and your thigh bone here at the proximal part of your knee joint there. And like I said before, our tendons crave this loading. Where physical therapists come in to help is because we need to tell you how much to load it. It's not just, hey, go home and squat 1,000 times a day and your knee's going to get better. That's not going to be it. We need to teach you ways to kind of to be independent with it, but to load that joint in the right amount and the right dosage. A lot of people come in for knee pain with whether it's arthritis or patellofemoral pain syndrome, and the first 3 days we focus on hip strengthening. Going back to that mobility stability model, our hips need the stability. Typically, our knees need the mobility. Now, that's not going to say that we don't need strength and mobility in both, but people are oftentimes incredibly weak in their hips. Quads and hamstrings tend to be a little stronger than those, but hips are typically neglected through everyday life. So that's definitely something we focus on early on to kind of set the groundwork for typical knee dysfunction. Ankle flexibility is something that I'm going to talk about in the next slide. McConnell taping, which is something I'll also talk about in the next slide, but it's a way to help keep that kneecap kind of in this groove a little bit better without deviating from that path. And then once again, I'll continue to harp on orthotic fitting because your hips and knees and back are only as good as your feet are. You need proper alignment. If you have a dam at this part of the river, downstream is going to be affected. The exact same thing happens with our body. We're only as good as the weakest link in our entire system there. So I like to talk about squatting briefly because I think it's a question we get often, and squatting, like Dr. Hartz alluded to, is fantastic for bone density, fantastic functional strengthening, but a lot of times we get people that look like this. And, we teach almost all of our patients with lower extremity or back injuries how to squat because it's such a functional motion. How do you pick things up off the ground? And I talked a little bit briefly about McConnell taping, as you can see, everything wants to travel in a straight path. That's the path of least resistance. So if you take a line from your hip to your ankle, the kneecap right here is put through so much more stress in this right picture than the left. So we teach people how to improve mechanics with squatting, and most importantly, this person probably has incredibly weak hips to allow those knees, and it's just kind of the position of comfort for the knees to kind of dive in a little bit. So that's something we often teach our patients. I'm going to briefly cover piriformis syndrome and glute tendinopathy. Like I said, all of these syndromes and conditions, we could talk for weeks about them, but I'm just trying to give you a brief overview. We get a lot of people that come in with quote-unquote sciatica. Obviously the pain generated that can come from several different places, whether it's low back, hip, sciatic nerve, things like that. But a lot of times people come in with this vague buttock pain. The sciatic nerve here runs very intimately with our piriformis muscle. So sometimes the sciatic nerve irritates the muscle, sometimes the muscle irritates the nerve, vice versa. But in terms of treatment, we really treat it the same way. We promote targeted stretching of this piriformis to decrease a little bit of that localized pressure on the nerve. And once again, hip and core stability. If you came into our clinic, a lot of our patients call us the glute police, because I feel like we say glute about 50 times a day to each of our patients, and just saying we got to activate the glutes because, no pun intended, they're our least utilized asset. So definitely something that we harp on a lot with our patients. Once again, activity modification is key for all injuries. Glute tendinopathy, which tends to be a little bit more of that lateral hip pain. As you can see, we have 3 major glute muscles, and they all tend to attach about in the exact same spot. So any irritation in that area can absolutely cause some pretty debilitating discomfort and difficulties with normal activities. Once again, properly dose strengthening. So if your tendon is injured, we're not just going to send you home with a bunch of exercises. We need to monitor you and make sure that you're loading at the proper amount for optimal healing. And then core and stability exercises, and once again, activity modification. Low back pain. So we're in sports medicine. We tend to focus on things of the extremities, but we see our definite fair share of low back pain. We're getting a lot better as a profession in treating low back pain, and we get better every year with it. But the primary causes or the primary modes of trying to help someone with low back pain are trunk coordination, strengthening, and endurance. I know that's a pretty broad term, but core stability is definitely going to be included in a plan of care if you're coming to a physical therapist for low back pain. In terms of actual pain control, so these types of things help with pain control, but are more for that long-term success. These 2 categories right here are more for that, let's get your pain down so we can get you exercising and get you that core stability you need. A lot of research is shifting towards this directional preference. I'm not going to get into that too much, but a lot of times what happens is everything that we do in our everyday lives is in front of us. You wake up, you brush your teeth, you put your socks on, you go down, you cook breakfast, you get in your car, you drive to work. Everything is in front of us. Well, we need that balance in our spine. That research shows that we bend forward a little bit to a lot over 3,000 times a day. We bend backwards about 10 to 15 times a day. And that's very rarely to end range. So our spine needs that balance, and that's kind of where this McKenzie method or directional preference kind of came about. And then we highly recommend progressive endurance and fitness exercises. So if you have low back pain, getting active helps. Any form of activity, whether that's walking, whether that's swimming, whether that's biking, they all tend to just help. And then rotator cuff dysfunction or impingement. We see this a lot in the aging athlete, especially because of some of the sports they tend to be drawn towards. But mobility, the rotator cuff typically doesn't get great strengthening with everyday life. So we need targeted rotator cuff-based exercises to help keep your shoulder stable and help keep it in the right position. So I'm going to briefly cover the 5 main sports that we see in the aging athlete. Like I said, this is not a comprehensive list, but some injuries you might see with it and some things that you might do to help with that. So tennis, we see a lot of tennis athletes. Typical injuries, knee, hip pain, shoulder pain, foot and ankle pain. Things that we kind of take-home messages for tennis players for injury prevention, good knee and hip stability. So like we talked about, using those glutes, having good stability because it's such a lateral-based sport. It's not like running or swimming that's almost all front and back. It's a little bit more side to side. And then obviously tennis, you're bouncing off one leg. You need that good balance and single leg stability. Cycling, most common injuries, low back pain, neck pain, and knee pain. The biggest thing I think with cycling, it's pretty good on the joints. It's repetitive, but it's not super high intensity or high loading. A lot of people come in and they just have a crappy fitting bike, and we do bike fits in our clinics, things like that. And you'd be surprised that if you have a bike that actually fits you, how much better you'll be at riding longer distances and just getting off your bike with a lot less pain. But as you can see here, it's incredibly hard on the back and neck. I mean, look at this neck position. That's pretty tough on the neck. So we focus primarily on postural muscle support, so back muscles and shoulder blade muscles, things like that. And once again, cross training is huge for cyclists because they tend to just get on their bike and ride and ride and ride, and they don't do anything else. So cycling doesn't carry over to everyday life that well. It's a great cardiovascular exercise, but we need a little bit of lateral movements to be healthy. Running, knee, hip pain, Achilles pain, low back pain are the most common injuries. I'm kind of a broken record here. Hip stability is big. Proper ankle range of motion is really big, especially for these Achilles injuries. Our ankles are usually a little too tight. We need about 20 degrees of moving your ankle up for proper running mechanics, and the average we see in the clinic is about 5 degrees. So they come in and say, all right, we give you these 2 exercises you could leave, and you're likely just going to get better with these things because your ankle is so stiff. Proper footwear is something, I'm not a shoe expert, but I know the people that are. So we refer a lot of people to some of these running foot stores and get them properly fitting shoe. Whether your foot is too mobile or too stiff, you need a shoe that's going to work with you. Cross training is huge, mileage tracking. So run with a purpose. Don't just go out and just run until you're tired. You need to have a little bit of a plan and figure out what goals you might have so you can run with a purpose and ultimately prevent injuries. Once again, gait assessment. We get people that come in that run and it just looks like a mess when we get them on camera. So we say, hey, there's just a couple small tweaks you can make and really make a difference. And like I said, usually the aging athlete isn't trying to decrease their time rapidly. They just want to run for exercise and run with less pain. And that's where a gait assessment can really help from a trained medical professional. Swimming, I'm absolutely not a swimming expert unless the doggy paddle is a preferred stroke. But neck pain and shoulder pain are the most common injuries we see with swimmers. And once again, just because of the sustained positions that you tend to have. But you need a good amount of shoulder range of motion for swimming, and the majority of the aging athlete just does not have that. So we tend to target the proper postural muscles and shoulder range of motion in these athletes. And once again, our physical therapists at Ohio State Sports Medicine, we have people that specialize in swim strokes. So why not utilize their knowledge and their power to help you swim with less pain? Golfing, this is a little bit near and dear to my heart. I could talk for hours on this, but the most common things we see are elbow pain, low back pain, and shoulder pain. Now, all of us see these guys and ladies on tour on the weekends, and we try and mimic our swings after these people. Well, when I'm shooting jump shots in my yard, I'm not trying to slam dunk like LeBron James because I know I physically can't do it. It's the same thing with golf. When people come in and they're like, I've been watching videos of Tiger Woods in 2002, and why can't I swing like him? Well, we're just not made for that. A lot of things that people don't have that they need, coming back to that mobility stability model, thoracic and hip joints in most aging golfers are extremely stiff. And what that means, I put a little picture up here without getting too detailed. This is called a reverse spine angle. So, we want to get a full backswing no matter what. So we're going to do whatever we can. The body is great at cheating to achieve that. So what happens, as you can see, this guy's kind of bending backwards so he can get that full backswing. And this is likely due to an extremely tight thoracic spine and extremely tight hips. So people that come in with low back pain that are golfers, they want me to work on their low back, and I say, we need to work on the hips and thoracic spine, not your low back. So it's kind of one of those things like you're only as good as the weakest link, like I said before. But correcting major swing flaws, which is easier said than done. I wanted to just give you guys a brief takeaway message here that, like I said, these slides were not intended for you to only treat yourselves. The biggest issue we have are people that come in and they wait way too long to see their physician. They said, I've been having this issue for 9 months. I said, what the heck have you been doing for 9 months? Like that's 3/4 of a year. We could have gotten you better much easier. Usually if you come in that acute phase, you go see your physician, and things tend to get better a lot easier when they're not in that chronic phase. Those are my references and Vince.
Great. Can you guys hear me? Am I on? Josh, I see we're tight on time. So I think what I might do, and true to form, you talk about the agent athlete, and these two have been making fun of me all week, and I had to get my cheaters out in order to read my notes here. So in our handout, I might just go through these very quickly so we can have time for Q&A, because I think there's probably a lot of direct questions for us through here. But one thing I wanted to try to do is once you kind of get up and moving and you are into a great habit and you have good exercises, sometimes the one thing that I think most of us do as we were athletes, we're still very competitive. So we continue to push a little bit further. So whatever 5K I ran on Saturday, that following month, I want to run a little faster the next one. So one thing that I thought I would come up with is maybe some ways that we can recover or make ourselves feel a little bit better so we can kind of continue to stay out on the track, on the court, or whatever it is we're going to do. And I kind of broke them down into free, cost a little bit, cost a lot. And I'm really cheap, so I'm into the free stuff that we have here. So some no or low-cost strategies to help. Static stretching, so just kind of stable position, moving one end. Low-impact exercises. So to me, any kind of pool, walking, swimming, yoga poses are another great way to continue to maintain some of your cardiovascular conditioning, great way to keep burning some calories, but letting the joints rest a little bit. And I think as we age, that's the one thing I'm finding. I can't run 6 straight days like I used to. I might do 2 on, 1 off. So those are some things that we can easily add in. So we talk about relative rest, and those are the things where we look at trying to control the things that we can control, right? So our frequency, intensity, time, and duration of the exercises. So those are things for myself. Typically, I would go through, and my frequency, it might be very intense exercise twice a week, 3 times a week. It may be very less intense exercise. So these are things we can kind of control. So things to keep in mind. Again, it doesn't really cost anything. It's just you using your noggin there. A couple other things, too, just to throw in there. Cold and heat. Again, sometimes there's some controversy on when to use cold, when to use heat. Can it really help us with recovery, whether it's not an injury, an acute injury or a non-acute injury? So there's different reasons to use both of those, but the one thing that is a great recovery tool is sleep. It's funny, we talk all the time with our varsity athletes at Ohio State, and we want to come up with all of these tools and these new things to help them recover. And part of it, what I saw in my conversation with some of our coaches, like, well, we have them over here doing so much stuff. Can't they just be in their bed for an extra hour? Like at the end of the day, sleep is a huge way for ourselves to help us recover. So don't forget sleep. And I think a lot of us, as busy as we get, we kind of forget that between ages 24 to 65, you still need 7 to 8 hours of sleep. So keep those things in mind. Things that cost a little bit more, and you see a lot of our athletes out there using these things, compression garments, not for performance, but for recovery. So the one benefit that I have seen with some of these compression garments, the socks, the tights, the shoulder, the ones for the upper extremity, they do help with some of our lymphatic drainage a little bit. So I have seen some benefit to that. All sorts of different apparatus to help our muscle lengthening. And so we can have these stretch sticks, we have stretch bands, we have these foam rollers. Kind of a very basic one down on the left side. In the middle, it's a little bit more medieval. It's a little bit more pokey there. It's a little bit more difficult, more advanced. And then also for some of our areas, we like to use, I like start with a tennis ball because it's softer, but go to a lacrosse ball, golf ball. If we get like tight joints, a lot of times trying to open our pec up, trying to help our rotator cuff and back, that might help us a little bit as we're going through to do some of our lifting. Things that cost, again, a little bit more. So we talk about water immersion, whether it's hot or cold therapy, sometimes a combination of the hot and cold together. There's some controversy, again, over that. But, you know, I'm a big proponent of, I think, using water therapy. I think it's very relaxing. I do think I like the hot and cold contrast treatments from a vasoconstriction to vasodilation to help us kind of get that flush. So kind of helping our lymphatic drainage. Massage, again, there's different versions of it. Don't get that massage down there. It's a little deep. But to me, the other benefit I see from massage is from a relaxation standpoint, again, helping keep it, it's kind of that using, you know, motion is the lotion, right? So we want to kind of use that a little bit. And I also think there's a real positive aspect of the power of human touch. I think that's very helpful. I think if I took an athlete and put a bunch of electric stem units on an ice bag and left them for 20 minutes versus someone I laid hands on and did stretching and some massage and some muscle activation, I think that second person gets better a little quicker. And I think some of it's just power of human touch. There's some, this is a version of Graston technique. Rock blades are things you can buy. It's this instrument-assisted soft tissue mobilization. Again, these things are a little pricey, and you need someone to do them. They look kind of medieval, I know, but the thought process is it can help lengthen some of the muscle tissue and maybe help separate that fascia in the muscle so the muscles move more freely. Problem with this is that it costs a little bit to get the training for it, and some of the equipment is very expensive. The Kinesio Tape, again, you see this on a lot of athletes that are out there. Again, efficacy is very, very low for this. I'm not going to lie, I've slapped it on athletes and they said they felt better, and I said, good, go out there, okay? So, full disclosure, sometimes we're here, we're working on that. I've used it myself and I've gotten nothing out of it, so maybe it's my application process. But the problem, it's getting much cheaper to do. You can buy these things at a lot of the different stores. My feeling is if it's going to keep us out there and keep us active and you get some benefit, go ahead. Again, these are costs a little bit higher. These intermittent compression units, you might see a lot of these things here. So they have some that are cold, some that are hot, some are just compression. So Normatec was a big company. I don't work for them, but there's a lot of other companies that are out there. Again, the idea is that it's a drainage, right? It's helping that lymphatic drainage. The problem with these is that the unit itself, there are some knockoff ones that are a little bit cheaper now, but they're still several $100s for someone to have. Last couple of things here, these are higher costs. These are things we might see in a clinic, or I'm starting to see them pop up in malls and stuff like that. So people are stepping up these recovery clinics. But low-level laser therapy, dry needling. Dry needling, again, kind of the use of some of the acupuncture needles, but to go in and work on muscle knots to kind of break that up and then help the brain and the muscle kind of communicate better so you have better movement patterns. I personally have used that myself, gotten a lot of benefits out of it. Those are things that might be part of a regular physical therapy program that might be indicated, or I know some people can go and just like setting up a massage, you could set up a dry needling appointment. So sometimes those are things that have been pretty helpful. And last couple things I just wanted to talk about, blood flow restriction therapy. It's really basically a type of tourniquet or a souped up blood pressure cuff that we use to kind of control venous flow, but we maintain arterial flow. It's really been made for muscle atrophy, but I'm starting to see some folks talking about this as a way to help recover. So we're kind of using it on some of our higher level athletes or people maybe post-surgical that are having a hard time maybe getting some of their muscle strength back. Flotation tanks, we see a lot of these out there, and I'm starting to see them again pop up in strip malls around there. Basically, it is a great way to relax. You're floating inside. Sometimes they'll use different types of salt water that might be in that tank, but it's a sensory deprivation type tank. And so I think a lot of it is probably beneficial. Again, it kind of goes back to that sleep and rest thing though, right? Last couple things, again, efficacy is very low for these things, but the hyperbaric chambers, again, you can to go through and it's 100% oxygen. We know we use it in medicine for some things, but what we've always done, I think in medicine or in sports medicine, we've taken things that have worked in true medicine and we've like tried to soup it up with our athletes. So they take it and bring it to another level. So these hyperbaric chambers, these cryotherapy chambers, again, it's sub-zero type freezing. I would never get in one of those. The efficacy, again, is very low, but I will tell you, I've had many of my athletes feel, they have said that they have recovered quicker. Will have a great workout on Monday, go through this treatment, and then they feel like they can work at that same level on Tuesday. So there may be something to, I think, as research goes through, we'll kind of see how that goes. And then this infrared light or sauna therapy, again, it's a way to use light for heat. It's kind of like I hate to say it, it almost looked like a suntan booth. We had a gentleman come in and show it to our team, and they just kind of lay there for 10 minutes, and I said, do you feel better? And they're like, no, I just rested, so it was kind of nice. And but again, those things are out. I'm seeing a lot of these companies now, like you could go do all three. It's basically a recovery store. So those are some things that are out there. And I just wanted to go through real quick. Hopefully we got 8 minutes for questions then.
So we're going to open up for some questions. So if you just want to raise your hand and come around with the mic. Any comments? Concerns? No.
No questions.
Anybody? Going once? Going twice? All right. Well, thank you for coming today. Thank you, guys. We have a health coach out. Yeah.
No.
Thank you, guys. We have a couple of the health coaches out there. If you guys have any questions for them, there are a couple biometric screening appointments available with Dixie, so you can see her for that. You guys all received an evaluation, so please make sure that you turn that in to Nicole or myself or one of the chairs that are posted at the door. Thank you for coming.